Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Centre. My name is Maryanne Matthews and I'm here with Dr. Stuart Kennedy, who is the Incident Manager for our hospital's COVID-19 response. So, Dr. Kennedy, why don't we start off this morning with a general update of how things are going at our hospital in terms of testing, patient numbers, that kind of stuff.
Sure, Maryanne. So at this point in time, we have 3 COVID positive cases in the hospital, and all 3 are stable, not in the intensive care unit. One has been in the hospital for over a month, so really not deemed significantly infectious at this point in time. And there's only been one has been less than 2 weeks, so their condition is quite stable. They have other medical problems that the medical staff and nursing staff are dealing with, but they're stable at this point in time. We have now, as of today, been able to increase our in-house and in-city testing. So we've got some new technology in our lab that allows us to do more rapid turnaround testing within our laboratory unit. And certainly the city lab, public health lab, is still up and functioning, not at full capacity yet. So we're anticipating less presumptive cases. Right now we have 33 presumptive cases in the hospital because of the turnaround time, but that is going to improve over the next 3 or 4 days. So all in all, we are doing very well as far as COVID-19 in the community. According to the Thunder Bay Health Unit, there's only 1 active case in Thunder Bay. We've done over 20,000 tests. And our rate of positivity to amount of testing we do is 0.5, which is probably one of the best in the province. So we're doing outstanding. We need to continue to do outstanding as the long weekend comes up. One of our concerns is that the travel restrictions from outside Northwestern Ontario has been lifted. And we are anticipating increased travel through Thunder Bay, or if not to Thunder Bay. And because the numbers are still fluctuating down east in other areas of the province, as well as Canadian provinces, I still think it's very important that we maintain our public health standards regarding physical distancing, as well as wearing a mask when you cannot keep those 2 meters distance. So all in all, we are doing well. I just want to make sure we continue to do well in anticipation of increased travel throughout the country.
Okay, great. And just to clarify, so you mentioned there's 3 positive cases in hospital. Health unit just reports 1 active. But that's just due to, because they've been in hospital, we're still considering them a positive case for precautionary reasons?
Yes.
Or length of time?
I think after the 14 days of isolation, which these patients, or 2 or 3, have completed, I think that's why the health unit numbers are a bit different than ours.
Okay, great. Thank you for clarifying that. So how are we managing here at the hospital with increasing patient occupancy due to service resumption, as well as increasing numbers of patients who are starting to visit our emergency department again?
Well, it's nice to see that patients are more comfortable coming both to our emergency department and actually are coming for their much-needed elective surgery. Because I've stated before, a lot of pain and suffering in the community right now. We have seen an increase in strokes, increase in heart attacks at our emergency departments, and that's because we feel that patients have sort of stayed at home a little bit too long. But now our numbers in emergency have increased. Our changes have occurred in the emergency department to enhance patient safety at all the times. Our staff in emergency are wearing their full PPE, which is gloves, gowns, masks, as well as face shields. So that would be the change when you see people come to our emergency department. And I would like to say to the public, I mean, out of respect for the staff in the hospital, out of respect for other patients in the hospital, I think it is important to all, when you come to our emergency department or our outpatient departments, to wear a mask or wear some type of face covering, because the evidence does show it does prevent the spread of COVID-19. And we do not want that to occur in our hospital. So as we get back to normal operations, our surgery has increased to 50% capacity, with anticipation of going up to 75% capacity over the next little while. We're going to see more traffic in the hospital, and as you see more traffic, there's always that risk of a COVID-19 entering the hospital. So I think we all have a duty of care to respect each other and wear that mask when you're in the hospital.
Right. So currently it is mandatory for staff to wear a mask when they're not alone in an office or in an area that can properly respect physical distancing requirements. But for patients and care partners, it's just strongly encouraged. Do we expect that to change soon then, following what you just said?
Yes, we're working on a policy as we speak to put a policy in place that masks will be mandatory for anybody entering this hospital. So you begin to prepare for that now. We have to put some procedures in place to make sure we never turn away patients in care, but certainly we expect patients, both patients, inpatients who are coming to the hospital, coming to the emergency department, coming to our outpatient departments, and if they're having sort of people, essential care partners come with them, the expectation is for them to wear a mask. Now, we don't have the resources to mask everybody who comes to Thunder Regional Hospital, so it's our expectation that the care partners, as well as the patients visiting our emergency department or outpatient departments, are expected to wear a mask with their own resources. And there's lots of opportunity to have access to masks out there. And if they can't just find a mask, they can just wear some type of facial covering. That also prevents any type of transmission of disease. So from our perspective, that is moving forward or in the very near future. So you might as well prepare for it now, that you will be expected to bring your own mask and wear a mask when you enter this hospital.
Right, and like you said, it could be a scarf or a handkerchief or something, as long as it covers nose and mouth, correct?
Yes.
Great.
Yeah.
So hopefully people can start getting prepared for that, because that'll be coming shortly. And now we have Canada Day tomorrow, so another celebratory occasion. People like to get together. Do you have any advice for the community on how they can celebrate safely?
Again, the public health rules should be adhered to, making sure they maintain their 2-meter physical distancing, and if they can't, to wear a mask. And certainly wash your hands, wash your hands, wash your hands. Sneeze into your arm to prevent spread of COVID-19. And again, keep your group size under 10. That's the provincial guidelines. And certainly, I think, Thunder Bay needs to have some recognition of how well they've done. So certainly celebrate Canada Day, because as a country, we've done quite well through COVID-19. One other thing I'd like to mention, Maryanne, is our sort of essential care partners in looking at our strict visitor policy. Mm-hmm. The reason we've been so successful at Thunder Regional Hospital of preventing any spread of COVID-19 at Thunder Regional Hospital is because of our restricted policy. And I've had a number of questions and other concerns from patients about our restrictive policy. We are reviewing our care policy, and we are looking at allowing care partners into the hospital at some point in time, but they will be quite restrictive in the sense the hours of visitation hours will be reduced, as well as the number of individuals allowed into the hospital. Because the more traffic flow we have in this facility, the more potential for spread of any type of infection. So we need to consider doing business a bit different, and we are going to maintain some very restrictive policies on visitation to the hospital, out of respect for the hospital staff and out of respect for the patients themselves. So stay tuned for something coming forward about care partners. And the reason we're so limited right now is, again, travel outside Northwestern Ontario. We do not know the impact the travel outside Northwestern Ontario for the next 1 or 2 or even 3 weeks. Once we are able to judge the impact by doing testing, I think we'll be more comfortable looking at easing some of our policies. But the best, sort of care right now is preventative, and I think we've done a good job, and I'd hate to go backwards.
That makes sense. So it's all about safety as per usual for this pandemic.
Yes.
Okay, great. Well, thank you so much, Dr. Kennedy. Thank you, everyone, for tuning in. Have a safe Canada Day and have fun.